Hello, I'm Jody Knarr. I'm a registered nurse, and up until about 5 years ago, I was pretty healthy. I worked full-time supporting myself and my son. I worked out at the gym and felt good most of the time. And then my life began to change. I became extremely fatigued. My hair began to fall out. My thyroid function dropped. My gallbladder became inflamed, and I had surgery to remove it, and it seemed like my health was beginning to deteriorate. I had to cut back to part-time work. As the years progressed, I began to have severe joint pain in my elbows and my knees. My doctor tried me on several medications, including Celebrex, Mobic, and Bextra. But none of these did a thing for me. Then the doctor gave me steroid injections into my joints, which provided only temporary relief. Steroid injections will cause permanent damage if continued, so this was not an answer for me. Then the man I had been seeing and was serious about died suddenly and unexpectedly. From then on, my health deteriorated rapidly. My hair loss became worse, the joint pain became worse, and I developed swollen, tender lymph nodes under my arms. I couldn't sleep, and I was diagnosed with severe depressive disorder. My blood sugar would drop suddenly, and I would have to grab a candy bar to get it back up. I was constantly getting sick with sinus infections and other respiratory problems. I felt bloated and was accumulating a lot of belly fat. I had to have uterine ablation due to my heavy menstrual periods. Because the doctors didn't seem to be able to help me, I began to research about my health problems. I found that I had the symptoms of fibromyalgia and even chronic fatigue syndrome. At that time, I was put on heavy doses of medication to try to control my joint pain, and I began taking antidepressants. I cut back on my work even more, and 5 months ago was no longer able to work at all. I got to the point where I was in bed 24 hours a day, just getting up long enough to take my son to school and back. I applied for disability, thinking that I would be sick the rest of my life and never work again. I had known Janet Polly and her daughter Michelle for about 9 years. They knew that I had exhausted all my medical options. One day, Michelle gave me a book to read. It was Dr. John Lee's book, What Your Doctor May Not Tell You About Premenopause. She told me that when I had finished, I should come and see her mom. I read the book, and I could see that I had all the symptoms of estrogen dominance. So I brought the book to Janet, and I said, "This is the story of my life." I learned that my heavy periods and premenstrual migraines were probably due to a lack of progesterone to balance out my estrogen. I also learned that my hair loss, my depressed thyroid, and my blood sugar problems were all probably related to a lack of progesterone. Because my doctors had nothing more to offer me, I became open to more non-traditional natural forms of treatment. Janet put me on a schedule of natural products that she felt sure would help me. She suggested that I take 1 tablespoon of AIM barley life 3 times a day in order to feed the sick cells the nutrients they needed to get well. I took Prepzymes 2 capsules with each meal to make sure my food was completely digested so it could be assimilated. AIM Mega 3 capsules twice a day so my body would have the essential fatty acids it needed. Proancinol 2 capsules every day. Proancenol is a balanced combination of antioxidants. Frame Essentials 2 capsules 3 times a day for my joint pain. This not only helps the pain, but supplies the joint with the nutrients it needs to heal. Flora Food 2 capsules daily to supply friendly bacteria for my colon. I learned that the friendly bacteria was killed off when I took antibiotics, and I had taken plenty of them. These friendly bacteria also make the B vitamins that I needed for my depression. Renewed Balance 2 pumps in the morning and 2 pumps in the evening. This is AIM's natural progesterone cream, which balances my own estrogen. She also put me on a program that included plenty of fresh fruits and vegetables with 3 meals a day, plenty of water, and walking 30 minutes a day. Almost immediately after following this plan, I had more energy and didn't even require a nap in the afternoon. I also didn't experience any breakthrough pain in my elbows or knees, and between my doses of pain medication and anti-inflammatories, which had been happening earlier. After the first week on this program, I was able to completely stop my pain medication, and my blood sugar stopped its wild fluctuations. My energy level increased almost immediately. When I felt migraine coming on, I used some extra Renewed Balance, and the migraine stopped. By the second week, I began to sleep better. And it has now been about 3 weeks since I started on the AIM products, and I am completely off pain medication and anti-inflammatories. My energy level hasn't been this good in years. I now understand that there is a fine balance between our nutrition, our hormones, and our exercise. And when this balance is upset, our health deteriorates. Now I'm feeling good enough to go back to work and start living again. I'm thankful to God and the AIM products for giving me my life back. And I'm thankful for friends who reached out to me in my time of need. Oh yes, I wanted my son Zachary to take Barley Life too, but he didn't like it. So I got a jar of the Barley Life Extra, and he likes it and he's taking it regularly. I'm so pleased about this.